speaking of firefighters, when we come back, we're going to pour some cold water on a few hot myths about your skin.
Your daily regimen may never be the same again. Stay with us. We'll be right back.
You know, everyday people struggle to control their acne by using at-home treatments that they believe are working for them.
Yeah, but what you may not know is that some of these treatments actually might be making matters worse.
Here to clarify all of those skincare myths is dermatologist Dr. Eric Schweiger. Dr. Schweiger, welcome.
Thank you.
So this is an important topic. Obviously, there's so many urban legends, home remedies, and myths out there about acne, but sometimes people are doing themselves a disservice, right?
This is true. There are over 20 million Americans with acne, and many do not know what to do at home.
All right, well, let's go through a few of these. Number one, diet can affect the severity of your acne. True or false?
That is actually true. So years ago, dermatologists thought there was no relation between diet and acne, but what we now know is some foods can make acne worse. Now, we never recommend that as monotherapy, but there are foods with high glycemic index that release sugar into the blood, which increase the level of insulin, which increase hormones, which can cause acne. So foods like breads and cereals are sometimes actually can be bad for your skin.
I've heard also a couple of friends, they say they avoid milk and cheese products because they say it affects their skin. Is that true?
Well, there was a study done that said cow's milk can be associated with acne, and they think that's because increased levels of hormones in the milk get passed on to the person who drinks it. So there is some science behind that.
Interesting. Okay, here's myth number 2. You can get acne from sweating.
Yeah, this is false. So I think it's important for people to know what causes acne, because it's not from sweating and it's not from dirt. Acne is actually caused by a bacteria called P. acne, which lives on the skin and gets into the hair follicles, and then it blocks the pores. And then what happens is you get too much sebum produced, and you get these white heads and black heads, and then your body sees this bacteria trapped in the skin, and it goes to try to fight off that bacteria, and you get the inflammation, which is the red bumps and the painful cysts. So it's not caused by sweat, it's not caused by dirt, it's caused by bacteria. That's why a lot of our treatments are antibacterials. Now, sweat can contribute to an acne-like condition called acne mechanica, where you may see football players with acne on their forehead or hockey players with their chin, and that's when they have a lot of friction from that strap, and it can cause like acne-like bumps. But it's different than real acne.
But it's not the acne that we're talking about. So to that, speaking to that point, myth number 3, washing your face more frequently helps prevent breakouts. But then it wouldn't, right?
This is a common myth, so this is false.
Yeah.
I have lots of patients who think they're dirty and they want to wash their face, and they end up washing their face 5-7 times a day. And what happens is they get really dry, and you remove some of the oils on your skin that actually are good for you. So if you have acne, twice a day is enough to wash your face. I recommend a gentle face wash, and then moisturizer after you wash your face. So a lot of patients think you want to avoid moisturizers, but that's not true. If you overwash and you under moisturize, you get what's called rebound oil production. And that's increased oil in your face and can make acne worse. So a good acne regimen is going to involve a gentle face wash and then a moisturizer afterwards, but not too much. Not too much face wash.
I was guilty of this when I was younger too. Sun exposure helps clear up acne. True or false?
This is overall, it's false. Now, we do have some patients who come in and say after the sun, their skin gets better. And that oftentimes it's because they have marks from old acne and they get tan and it kind of hides it. Now, if you are someone who notices that post-sun exposure, you have improved acne, then there are options for you. First of all, avoiding the sun is our recommendation, because 1 in 3 people get a skin cancer. Okay? And it's not worth trading acne-free skin for skin cancer. But we have treatments called blue light therapy, and blue light will actually kill the acne bacteria that's on the skin, which works very effectively, which can be done in the office, or there are at-home devices you could buy. So if you are someone who has better skin in the summertime, I recommend blue light therapy year-round.
Interesting. How about the myth that shaving can worsen acne? True or false?
There is some truth to this, and it's really not about the acne, it's about the scars and the marks. So we have teenagers with significant acne and then facial hair, and if they try to shave over the entire area, they often will cut themselves, and that can lead to scarring. So, when you have active acne, it's really important you're careful when you shave, or you may have problems.
Here's one that I think we're all guilty of. Popping can clear acne. Is that true?
Popping the pimples?
False.
Well, I think it's not a good idea. So false that it's a good idea. I tell my patients, do not do bathroom surgery. You know? So everyone at home has often a routine which involves closing the bathroom door and walking out with bloody hands. And that's not good for your skin. You know, if you have an active pimple or something that looks like it should be popped, the best thing you can do is to go to your dermatologist. You know, it's important to get a cortisone injection or an extraction, and we have lots of patients in my offices in New York who come in for same-day cortisone shots, which will decrease the acne within 24 hours. And we can do extractions too, but we'll use safe and sterile material, and it's just better for the patient. Decreases infections, decreases scars.
Yeah, probably not good after a breakup either.
Yeah, bathroom surgery.
No.
That's just the idea of it. All right, another myth. Applying toothpaste to a zit will clear it up. Fact or fiction?
This is fiction. You know, toothpaste should be reserved for the mouth, not for the skin. So this is an old wives' tale where people put on toothpaste on their pimples and they wake up and it's gone. I think this comes from 50, 60 years ago when there weren't all these great options for acne treatment, and maybe there were some drying ingredients which could help. But today, acne treatment has evolved. We have all of these great at-home spot treatments and preventive treatments. I recommend either benzoyl peroxide or salicylic acid products. We've just made a product from our Clear Clinic line that it's called Vanish, which has salicylic acid, glycolic acid, and zinc. And when you put these on, in 2 or 3 days, you should notice a big improvement.
So no toothpaste, otherwise you'll have minty fresh skin.
Minty fresh zits, which is not what we're looking for. Dr. Schweiger, thank you so much.
Great.
Really
Stay
good
with us,
information.
though, because